Hello, everyone. I am Dr. Chris, a consultant family physician and a lifestyle medicine expert. Today, I will be discussing how you can permanently reverse hemorrhoids, also called PILE, using a lifestyle medicine approach. What are hemorrhoids? Hemorrhoids are swollen veins in the anus and lower part of the rectum. There are types of hemorrhoids. Hemorrhoids can be internal, external, or prolapse. Internal hemorrhoids occurs when the swollen veins are within the rectum, and they are also described as external when the swollen veins are around the anus, and prolapse when it presents as a bulge through the anus due to bulging of the anal cushions. Epidemiology. Hemorrhoids are very common. The worldwide prevalence of hemorrhoids is estimated to be around 4.4%, meaning that 4 out of every 100 persons have a hemorrhoid. So this is a very common anorectal condition. Problem. What is a problem when it comes to hemorrhoid? It's important to note or understand that hemorrhoid itself is not a problem. Rather, a hemorrhoid or a pile is a pointer to a problem. The underlying problem is poor gut health. So the hemorrhoid appears just as a sign to tell you that you have a problem with your gut health. And the way to look at hemorrhoid is this, using this analogy. Hemorrhoids are like the signs you see on your car dashboard. On the car dashboard, you see several signs like the brake sign, you see check engine sign, you see oil sign. Now, if you're driving your car and you see the oil sign displaying on the dashboard, the oil sign is not a problem. The oil sign is an indication that the car needs servicing, that you need to replace the oil, or maybe the oil has even gotten finished. Now, if you choose to ignore the sign, or you decide to take the car to the car electrician so that they can remove or turn off the sign on the dashboard. If they do so by turning off the sign on the dashboard, that does not still take away the fact that the car needs oil. So even though the electrician has taken out the sign on the dashboard, making you to feel comfortable because it's no longer shown on the dashboard, but the problem is still there. And if you continue to use the car engine can knock. Now this is a perfect analogy for hemorrhoids. When hemorrhoids are showing up around the anorectal region, it is just a pointer, just an indicator that the gut health is poor. But many people get carried away with the sign and they try to aggressively treat the hemorrhoid, sometimes with medication, sometimes with surgery. But the thing is this, even if you treat this hemorrhoid with surgery, the hemorrhoid will always reoccur because you have not taken care of the root cause, which is the underlying poor gut health. And also, surgery can also come with some complications, either complication from anesthesia or complication from the surgery itself. There can be injury to the anal sphincter that may lead to fecal incontinence. So the risk of surgery is much, yet all surgery and medications does not tackle the underlying cause. The underlying cause is the poor gut health. Once you fix the poor gut health, the hemorrhoid will disappear on its own and will disappear permanently. Now, what are the symptoms or clinical features of hemorrhoid? Because these veins around the rectum and the anus are swollen and engorged with blood, they can easily bleed during defecation due to straining and passage of hard stool. Now, this is a primary symptom of hemorrhoid. Other secondary symptoms may occur, such as soreness or itchiness around the perianal region due to leakage of mucus from the anal canal. These are all secondary symptoms, and patient may feel a lot of discomfort. And occasionally, hemorrhoids can become painful when there are thrombose. A thrombosed hemorrhoid is when blood clot forms within the swollen veins. They can become painful only when thrombosed. Now, how do you fix this gut health I'm talking about? You can fix the gut health by following these underlisted 5 approach. 1. Diet. You must take a high fiber diet on a daily basis, every day. Eat lots of vegetables and fruits. This provides fiber, which helps to increase the stool bulk, prevents constipation, and make it easy for you to pass stool. Second way to fix the gut health, number 2, is to stay well hydrated. Drinking plenty of water is essential, as water plays a crucial role during digestion of food. So water helps or aids digestion. Aim to drink between 3 to 4 liters of water per day. Next step, the third step to fixing your gut health is to avoid any form of straining during defecation. Straining worsens the hemorrhoid and may also lead to bleeding. So avoid straining. Do not rush yourself through bowel movement. If you want to defecate and you notice that the stool is not coming, do not strain. Rather, postpone the defecation for another time or the next day. While waiting for the next day or another time, go and eat more fiber and drink plenty of water and try another time. Do not strain during defecation. And the fourth approach is to avoid. Okay, and the fourth approach is for you to exercise. Exercising is very important because exercise acts or serves as a probiotic. This means that exercise encourages the growth of healthy bacteria in the gut. These healthy bacteria in the gut are called the probiotics. They help with digestion. They also help to protect the integrity of the gut, preventing toxins from being assimilated into the bloodstream. These probiotic bacteria also produce what we call the short-chain fatty acids. These short-chain fatty acids also help to prevent colon cancers, inflammatory bowel disease, And they also help to decrease inflammation in the body, and they also help to improve insulin sensitivity. So exercise plays a crucial role in improving or fixing your gut health. And the last approach is for you to avoid alcohol. Alcohol can cause hemorrhoid as well as even worsen hemorrhoid. This is because alcohol have a diuretic effect. When you take alcohol, it has a diuretic effect. It makes you to lose plenty of water, leads to dehydration, hardening the stool, and making hemorrhoid worse. So once you adopt the above five approach, it will help you to fix your gut health, and hemorrhoids will reverse on its own and reverse permanently. For the secondary symptoms of hemorrhoid, like the itching, perianal soreness, and rectal protrusion, you can use antibiotic cream and apply it around the perianal region to reduce discomfort. And for the anal protrusion, you can do a sit bath where you add plenty of salt to a lukewarm water and sit on it for like 10 to 15 minutes. This helps to reduce the prolapsed hemorrhoid. But on overall, the permanent solution to fixing your hemorrhoid and curing it is for you to fix your gut health by following the above five steps I have already outlined. Thank you for watching. Please do not forget to like, share, and subscribe for more healthy lifestyle tips like this. Thank you.